And Obamacare causing unthinkable problems for some doctors, for themselves, their employees, and their patients. Dr. Rick Henegan joins us. Good evening, sir.
Good evening, Greta.
As I understand it, you've lost your health insurance, sir?
That's correct. Our group health plan has been canceled as of about a month ago.
And in terms of, I mean, you've got a number of employees, and you provide health insurance for them. Have you attempted to find out, like go on the website to see if there's some insurance you can get for them and what the cost would be?
Right now, we're waiting on our broker to get back with us. She's supposed to have some figures for us by the end of this week. The only time I went on the website to check it out, it was down.
And so what is this doing to your practice?
Well, the employees naturally are concerned, as everybody, just like the other millions of Americans that are uncertain about their health insurance as it's been canceled, as ours has. So we're just waiting to see what kind of premiums are going to be, because I've been providing health care insurance for my employees for 30 years without a mandate as a benefit, and I'd like to be able to continue doing that.
All right. Now, what about your patients? Are you still are they still able to go to you, or have you been tossed out of the network and they go on the exchange to see you?
Right now, everybody still has their insurance until the end of this year, so it's not affecting me at this point, but we can't find our name anywhere on the exchange, or our patients can't that go on the exchange, and we have no idea how to get on it. Nobody's contacted us about that, so we're looking into that right now.
About how many patients, what's the number of patients that might involve, people who are looking to find you on the exchange and can't at this point?
Well, for our entire practice, there's 6 providers. It would be thousands of people that would be looking.
And so what, I mean, are you a little panicked? I mean, are you making calls and saying, look, we've got to fix this. I'm a doctor. I'm not a business person. I'd like to be spending my time taking care of my patients and not on hold listening to some music, to some healthcare hold line?
Well, we're doing everything we can to try and contact the state exchange to find out what's going on. They're not very responsive. We haven't been given any information about it to begin with, but they definitely have enforced all the regulations from Obamacare in terms of the electronic health records.
All right. In terms of, I know there's a major headache right now, and it's very terrifying to a lot of people who've had their insurance canceled, but I'm curious, overall, do you have optimism for Obamacare, or do you think that it'd be better to sort of scrap it and start all over, or what's your thought on it?
I would like to scrap it and start all over. I just don't believe that anything that's not patient, doctor, centered is going to work to the betterment of the healthcare of the American people. You know, when government gets involved, as we've seen with this rollout, it's inefficient. It's going to be way more costly than it could have been. And I think there's some very good ideas that other people have about how to reform healthcare in this country that are far better than what we're looking at now.
Doctor, thank you very much. And I always thought there ought to be more discussion when in developing a program that talk more to doctors and patients than to sort of business people, insurance, and politicians. And you know, might be a little better in terms of how we treat people and how we take care of them. Doctor, thank you.
Thank you. I'd like to say Happy Veterans Day to my brother Pat and all the other veterans out there. Thanks.
Indeed. A happy Veterans Day to your brother and everybody else. Thank you, sir.